So today we're going to talk about sympathetic versus parasympathetic just a little bit. So when we're thinking about my autonomic nervous system, so the part that I am not thinking about, we can separate that into the sympathetic, which we refer to as fight or flight. You'll also hear other things like fawn and what have you, but for right now we'll think of fight or flight, because think of, am I going to fight a bear or am I going to run away from a bear? Okay. Whereas most of us are not going to fawn over a bear. A bear is a scary thing. The other side is going to be the parasympathetic, which is going to be that rest and digest. Right? Think again, if I see a bear, unless it's Winnie the Pooh, I am not going to be sitting and eating. I'm not going to be taking a nap. I'm probably going to be running, right? So parasymp, no bear. Symp, bear. Okay. And these effects are what our body will naturally do to adapt to different things. It doesn't just mean, oh, there was a bear and there's now not a bear. It's very rare that you're going to run into a bear, but it is common that you're going to need to bring up your blood pressure for things like climbing the stairs, right? So we use aspects of a sympathetic response and aspects of a parasympathetic response to be able to function. I do want to point out our body loves the parasympathetic and would prefer to sit in that. And that's part of why we try to say limit the stress responses, don't be overworking out, okay? But how they're organized and what they use is pretty similar. So for both of them, anatomically, we're going to have a ganglionic neuron. Forgive my ugly neuron. So we're going to have our preganglionic neuron. And this is going to be it's going to be a cholinergic nerve, so it's going to release acetylcholine. Okay. And that acetylcholine will then activate receptors on the postganglionic nerve. So we've got our postganglionic. And it does so through different receptors that it can pick up on, so we know I'm sending a sympathetic, parasympathetic response. And then depending on if it's sympathetic or parasympathetic, it'll send different neurotransmitters. So the neurotransmitters that we see, okay, so for sympathetic, it's going to release epinephrine, or E, norepinephrine, or NE, and it will also, in some cases, release acetylcholine. The epinephrine is going to be, if I'm running from a bear, I need to breathe, I need to move, I need to get away. So think about big breathing, right? So opening up my airways, right? So this is why we use an EpiPen, so a pen full of epinephrine for anaphylactic shock. It's also going to have some impact on the heart, primarily through kind of increasing its heart rate and contractility. And then, but it's going to work alongside of norepinephrine. Okay, so norepinephrine is going to do vasoconstriction. So we're going to constrict all of my blood vessels, bring up that pressure, get the blood rushing back to the heart. It's still also going to be involved in heart rate and contractility. And the reason for that overlap is because both of them are going to be associated with some of the beta receptors. Okay, so we have beta receptors that are what when you hear somebody saying, I'm taking a beta blocker for my heart health, it's because these are overactive and we're trying to bring down that pressure. Acetylcholine is really only used for sweat. Okay, so again, I'm running from a bear, I'm running really fast, I'm going to overheat if I don't sweat it out. So in the sympathetic response, right, so if your body is under that stress, you will start to sweat. For parasympathetic, it's pretty easy. It just uses acetylcholine. Okay, so we're going to see acetylcholine secreted everywhere. It just depends on the type of receptor that it's interacting with, of what the response is going to be. But anyway, I hope this kind of helps separating the two and which neurotransmitters they are using.